It really is possible for anyone to stop anxiety and panic attacks for good, and you can too. It's not your fault that you continue to suffer the burden of anxiety. There are millions of others just like you. Imagine being confident that no matter what happens, you can deal with the situation easily. If you suffer from anxiety attacks, you may be tempted to just take medication as a way to alleviate the attack. While medications for treating anxiety have come a long way in recent years, you might want to consider some sort of therapy to help you overcome this somewhat disabling condition. Many people today are still hesitant about going into therapy. The stigma of seeing someone about a mental disorder has not left society, although this is getting better. An estimated 30% of people in the United States have sought counseling at one time or another. It is nothing to be ashamed of. In fact, you should welcome the opportunity to be proactive about your mental health. You have a choice today when it comes to choosing the type of therapy to treat your anxiety attacks. Here are a few choices that you have. Counselors will treat those with mild to moderate anxiety attacks. They usually work with the person by giving them exercises as well as allowing them to talk about their feelings. At the end of the session, the counselor will normally reiterate everything that the patient said so that they can understand what they can do to make things better for themselves. Counseling is usually available in a number of different avenues, include some free counselors who work with townships and other municipalities. Even if you do not have insurance or are below poverty level, you can find a counselor who can help you with your problems. Therapists usually follow a treatment plan. They will give you exercises that you should do and will teach you how you can cope with your anxiety or depression. They are a good choice when you are suffering from severe anxiety or depression. Your problems will not be alleviated in one session, but will usually take more time to solve. Expect to see a therapist for a while so that they can get to the bottom of your problems. The psychologist is usually what you think of when you are considering counseling. They have the reputation of making you lay on the couch while they listen to you and take notes. They will want to get to the bottom of the problem that you are having, including things that happened in your childhood. They usually have more extensive training than counselors and therapists, but also come at a higher price tag. Your sessions with a psychologist will last longer than with a therapist or a counselor, but you can get some pretty good results. A psychiatrist is a medical doctor. Most psychiatrists work for hospitals and with those who are seriously mentally ill. You might be referred to a psychiatrist for medication, but chances are that you will see a therapist or psychologist for your therapy. For anxiety and depression, unless you are hospitalized for this condition, you will most likely not be referred to a psychiatrist. However, this doctor has the most experience and can make an accurate diagnosis of your condition. I have a series of free videos to help you stop anxiety and panic attacks for good. It's going to help you to sleep soundly, laugh with your loved ones, and take on the world with confidence. Click on the link below and get it delivered immediately.